Mhm. Mhm. Okay, hello everybody. My name's Lianne Urada, and I'm an associate professor at San Diego State University and UC in the School of Social Work and at UC San Diego in the School of Medicine. And I'm the principal investigator of a research study that's funded by the National Institute on Drug Abuse. Sorry, now my slides are not advancing. Okay. Thank you so much to San Jose State University for sponsoring this. And I'm going to be showing you the results of our study, the preliminary results. We've been doing this for about a year, but my partnership began with the library a few years ago, actually right before the year before the pandemic. And so I have several partners here, both at UC San Diego and San Diego State. But also what was really important was the partnership with the library, and then also with the federally qualified healthcare clinic, Father Joe's Villages in San Diego. But first, I want to just talk about opioid overdoses and this treatment that's called buprenorphine. So if you haven't heard of it, it's a medication-assisted treatment for those who are who have opioid use disorder. And particularly, we are recruiting and enrolling people who are unstably housed, which fits the theme of this conference. So I first came up with this idea because the libraries, particularly the downtown Central Library in San Diego, was experiencing overdoses inside their library, in the bathrooms, also just in the surrounding community. And they were really concerned about how to help this population. And so in addition to putting a social worker in the library, social worker interns from San Diego State, we also did launch this needs assessment. So myself with the library, we interviewed many people who are unhoused as well as the library staff to try to come up with some assessment of the problem and also some solutions. So the solution was to partner with the clinic that primarily serves those who are homeless, and it's just down the street, about a 10-minute walk, and to see if they can provide telehealth through the library, with the library providing the space and the access to the internet. So the library actually created an iPad on a stick and put it in a private study room. And individuals can actually talk to their medical provider at Father Joe's Villages Health Center through that iPad on a stick. So what we did was we recruited through by using flyers. We are not supposed to approach people within the library because that would, if they're using the library, that kind of could be discriminatory. It could, they might feel uncomfortable with us approaching them. So we have them approach us. We post the flyers. The flyers have been very helpful when it's posted, especially at the front desks. So people will contact me if they're interested in the study that way. Once in a while, there'll be a PA announcement in the library. This is a 9-floor library. So they'll say, oh, we're this research team from San Diego State is doing a telehealth study. And we're in the meeting room downstairs, and they'll come that way as well. But we also did outreach right around the surrounding libraries. The libraries are very, welcoming to the community, and they welcomed us finding people who would be interested in coming into the library for this study. Most have already been using the library, but it's also to get those, especially those who are homeless, to come inside and access services. So we've already received a lot of media coverage, as you can see here, from at least 3 or 4 different news outlets. And we've been doing this again just a little under a year. recruiting participants. It is a pilot, meaning this is a very small study that we're hoping to scale up if this shows successful. And I will show you our results in a minute. We're only targeting 40 people to fully enroll in the study. It's a randomized controlled trial. And so what that means is that once people see the doctor for the first time at the clinic, they are then enrolled either to receive telehealth services through the library or to keep going in person to the clinic. But for everyone, all 40, we did follow up with them every week for 12 weeks in the library. So whether they're in the telehealth group or the control group, they all come to see us every week. We provide, snacks. We give it $20 as for their time, taking the survey and follow-up interviews with them. And then we also did urinary drug screenings. It was really pretty much self-administered in the bathrooms. The library didn't mind that they use the bathrooms for that. It's just a stick that they dip in their urine for 20 seconds and they throw it out, and they just bring back the stick in a kind of biohazard bag that we have, and we just record it. So this is a little bit easier to view on the screen. So I'll show you. We screened 196 people. We did baseline surveys of 161, and then we referred them to the clinic to get fully screened and enrolled for eligibility. So most of them we screened were eligible. However, 52 of them actually made it to the doctor for the first time. And it's sometimes they are reluctant to go to the doctor, or they forget, or they don't want to wait in the waiting room. So all of this is the reason why the clinic was also really interested in testing out telehealth in the library, because they're very comfortable being in the library, right? So of the 52, we're still continuing for the next 3 months to follow them, but 40 of them already, we followed them for 12 weeks. So that's what I'm reporting on today, the results of that, because they completed the 12 weeks, which was our goal. So about half of them, 21, was randomly assigned to library telehealth, and then 19 to the in-person clinic visits, the control group. So overall, we had a pretty diverse demographic. Just under 50% were white, and then we had about 30% Latino. You see Black African American, about 15%. This shows the breakdown in which group they were randomized to. And then in terms of the gender breakdown, there was about a quarter who were women. And there were a few people who were transgender persons. And then in terms of age, the average age was 44, 45 for each group, but the range was 26 to 68 overall. So I'm happy to report that we weren't sure if it would be successful, but it is showing a trend towards being successful, because 95% of the telehealth group, 84% of the control actually picked up their prescription, their buprenorphine prescription from the pharmacy. And we checked that, we verified that through a federal cures database that they give us permission to look at. And then 71% of the telehealth and 21% of the control picked up the prescriptions 2 to 10 times. And that is actually, from what I hear, is actually a really good outcome. And 3 are still picking up their buprenorphine even 7 to 8 months later. So before our study, only 5% even knew where they could get this medication to overcome their opioid addiction. And so already that's a really good finding, that so many now know at least where they can go. And then in terms of reducing and stopping their substance use, the telehealth group was 3 times more likely to do so. So about 71% versus 23%. It's not to say that they completely stopped, but if they're on the medication, they definitely did reduce their drug use. And sometimes they would relapse during the 12 weeks. But again, this is almost the harm reduction, just really even trying to save lives so that people don't continuously overdose and die. So many people have died, or so many people say they've died and come back to life. But we're just really trying to do everything we can, because buprenorphine medication, although it can be difficult sometimes to tolerate during the transition of getting on it, stopping their drug use a few days to get on it so they don't have withdrawal symptoms. It is something that the federal government especially is really enthusiastic about, but is having trouble rolling it out, getting people on it for various reasons. So in this case, we had, the library being willing to try this out, the clinic and the doctors being willing to prescribe it, because some places that, hasn't really picked up as much as it should. Pharmacies can be difficult because they have to have an ID. And as you know, many lose their IDs, but they could find someone else with an ID. So this was a wonderful finding that they actually were able to pick up their prescriptions. And then overall, the telehealth group did stay with us, retaining the study longer than the control group over the 12 weeks. So the greatest finding, because it's our primary outcome that we're looking at, is that they tested positive for buprenorphine. So 62% in the telehealth group versus 32% actually tested positive in the urine drug screenings for taking the medication. So not only did they pick up the medication, they're actually taking it, right? And telehealth group was 2 times more likely to take it. And they were also 2.5 times more likely to see the medical provider more than once than the control group. So again, it's actually a big finding for them to go there, to have gone beyond that first visit. Our pilot study established feasibility. There is a potential for the intervention to work on a larger scale. And so the next step would be to try to scale this up, perhaps to more libraries. We tried it with 2 libraries, could be scaled up to test out with even other cities. A lot of libraries across the country could try this out. There's been some excitement. I just returned from a conference in Montreal where I've shared these results. There is some caveat, I guess, some lessons learned and limitations, and it's something that we will continue to work out. But everybody did receive, as I said, the $20 incentive, both in the control group and the telehealth group, and they received snacks, and they received kind of case management and social work support. Our social work interns were also helping us collect this data. So we did do a lot of supportive services. It's something that maybe, libraries and librarians would consider too, is having that social work in the library help them, because it's not easy on their own, I think, to show up for an appointment and do the telehealth, coordinate that appointment with the doctor, even if it is a low barrier, drop-in. But even then, that could even be more difficult, because if it's a drop-in medical appointment, they do have to wait, just like they're waiting in the waiting room, but instead they're waiting in the library. So there's some kind of even just opening the door for them and saying, okay, here, you can go see, you can get on the platforms to do the telehealth. Just a little help can help, but also we were following up with them, so that can help. So I think so that is a lesson learned. I think there are those who could do it by themselves, just with the help checking things out with the library. But I think with this population, because so many are polysubstance using, meaning not just fentanyl and opioids, but also methamphetamines, it can be quite challenging. And that's probably what the libraries are facing as well. So I just wanted to end with this quote, some positive quotes. Someone said that the medication helped them sleep, it cleared their head, they're able to think much better. The biggest change has been my lack of craving for using drugs. Another one said that Suboxone, or the buprenorphine, helps me to follow through with interviews. They were basically living in a campsite, in the riverbed, and that they just left everything. They applied for a job, they actually got into a shelter, they had a group interview. When you're on the street, it's harder to follow through, they said. So again, this is the lessons learned and limitations I was just mentioning, but one key thing is the sustainability. factor. We did really try to make it so that the library didn't have to do anything too much out of their business as usual. And the clinic also didn't have to do too much other than what they're already doing, so that it could be sustainable, so that when we leave as researchers, that this can continue. Again, with some support, I think on both sides will help. In terms of the intent to treat analysis, what that means is everybody who was randomized to the telehealth group and to the control group, we kept them in those groups when analyzing the data, despite the fact that not everyone may have tried telehealth in the telehealth group. It was a little over half that did try it, but they were eligible, and so that's why it's called intent to treat. I just want to acknowledge the teams. So we have the UC San Diego State University teams. I have doctoral students, master's students in social work and public health, and other research assistants. What was key, I think, is those with lived experience also, who are going to school and wanting to kind of give back. And they're really passionate about this, especially doing the outreach and also learning how to do the surveys. So we did engage even some who are taking buprenorphine themselves. That's been wonderful. So some of them are pursuing their substance use certificate at a community college, and they've been very helpful and enthusiastic. Father Joe's Villages is the Village Health Center, and San Diego Public Library, the different library managers that really helped. This was kind of a first-time research partnership with them around this. For both the health center and the public library, especially around this issue. And then again, the funder, Dr. Evan Hermans, the program officer there, very supportive. So thank you very much. I want to leave some time for questions and answers.
Lianne,
oh my goodness, look at all these people.
Yes. Ami is asking a question.
Okay, in the chat?
In the chat, she asks, how did you find medical providers to participate in this?
Okay, yes, great question. So, yes.
And especially those without health insurance.
Yes, thank you. So those are great questions. And so Father Joe's Villages Health Center, they're a federally qualified health care center, which is there's many across San Diego and across the country. And so insurance, medical insurance now, like everyone had Medicaid insurance, so that covered the medication, if that was a question. But the medical providers themselves, so they were very happy to partner with us because they're already seeing this population and providing the prescription. But so many of them, like in our population, didn't know about them, didn't know that they could get it there at their health center. So they were pleased to partner with us. I mean, Father Joe's Village is quite known in our community for serving those who are homeless. And again, they're down the street from the library. But I think I first started thinking about the partnership with them when one of my master's social work joint public health students did a thesis with them and looking at their medical records and specifically at this population. And they found that support, like seeing a supportive counselor, helped them adhere to their medication more. So with that, I forged that partnership. And then I'd already been having that partnership with the public libraries. So I thought about putting them together. And that has been kind of the path we took. So everyone, if they didn't have their health insurance, Father Joe's Villages, they do have other funding sources, especially private funding, because so many people, there's so many volunteers and donations that go to them as a service provider, primarily for those who are homeless. So they will cover any kind of, even a copay, even if it's temporary, or they'll cover the medication itself for them. And they provide, all of their medical services are free already. I think federally qualified healthcare centers, they all pretty much do that for free. Yes, that's my email. You can find me at San Diego State School of Social Work. I'm faculty there. So Urada@sdsu.edu.
Do you have plans on taking this study to other states or cities?
Yes, that was the next plan. Well, that's something that I will be talking to my program officer about. What is the best plan? Should we scale it up further in San Diego or test it out in a second city? So that's how these larger grants beyond this pilot grant, a larger like NIH, R01 study would cover more people, like would cover at least 300 and across a couple of locations. And the rationale is to further test out if it can work in really a different environment. So the two libraries we had, they are in two different environments. One is right downtown, but the other one is a smaller library and more of a suburban, rural, not really rural, but it's closer to, it's called Mission Valley in San Diego County. And it's more near the riverbed where there is a very different population who are using opioids there. So oftentimes unhoused folks don't have access to a phone. How did you stay in contact with them? Yes, that's definitely the hardest challenge. So sometimes we would just, if we found them right outside the library, like literally, leaning against the library wall, the next day, we had a better chance of finding them again. There were some with phones and emails that were easier to contact them again, but oftentimes they would lose their phone, but then they could get a new one again, even with the $20 we gave them. Sometimes they would just turn around and get another phone. But there were so many that just didn't have phones or the phone numbers stopped working. So that was definitely difficult. We do ask if we can't find them, is there somebody else that we can contact? But so many also with this population didn't have anyone else. There were a lot of couples, so there were, they did have somebody, but that's always a challenge. So because we have outreach teams, we do try to go and find people, encourage them to come back. And there's not much more we could do with that. We also did need to have a phone in the library because the clinic wanted to be able to call them to let them know that the doctor was going to be ready, or to see if the patient was ready to see them as they're waiting. So that kind of posed a challenge and barrier, but the library has been able to, at least one of them has been able to have a phone available in the library. And then the other one, we try to help them out with being present. That's kind of how that helps. Having someone else help them with the telehealth will help, because a phone can be necessary. But we're still trying to work that out to make it smoother. The ultimate goal, though, is to scale this up to other cities and states. We have to prove it's successful, and so that's why we do a randomized, controlled trial, because that shows effectiveness, that it can work. And we've done it on small scale, but we'll need to do it with probably at least 300 people, and then it could be adopted by others. and I do disseminate it where others can learn about it. So at this national conference, CPDD, it's a college on problems of drug dependence. They just celebrated their 50th anniversary, and it was in conference was in Montreal, so I just returned last night. But oh, I guess we just have 4 minutes, but does anybody here think it can work in your libraries? You could put it in the chat if you. Oh, Phoenix. Great. Ah, Oregon. Oh, Hillsboro. Great. Hemet. Oh, wow. You have a medical clinic at the library in Indiana. Hmm. Yeah, that's even better. We thought about having a doctor there, but in order to scale this up, in order for this to be scalable to places that don't have that kind of support or financing to have a doctor in the library, I was actually discouraged by the funder not to test that out. Did you have to do anything to make the study room HIPAA compliant? The study room, when they're doing the telehealth, maybe. So the clinic itself, they use something called doxy.me. That's their preferred platform instead of Zoom and things. But there is HIPAA compliant Zoom. So but we went with what because the clinic is definitely HIPAA compliant and always concerned about that, so we went with that. And then having the study room itself, you can't hear anything on outside of those study rooms. So libraries that don't have study rooms, that could be an issue. I would say at least having some headphones or something could help with the privacy. Oh, somebody asked which library we have telehealth for veterans setup. A very small library with small staff. Yeah. Oh, in Vermont. Okay. Did you have, okay. Seattle. Yeah, and I think just even somehow letting people know where they can get treatment because they really didn't know, and it was just down the street. And many people are moving around and they're coming from other states and they're looking for where they can get their buprenorphine because it worked for them in the other state. So they did appreciate finding out where to go. Oh, I'm sorry, I should definitely let you all go to the next session. It's 2:00. So thank you so much for participating and coming. Really appreciate it. And I will stop the recording now.